Now we have almost 70, 80 participants now. So let's start our session. Welcome everyone to our distinguished guests, attendees, and panelists. I'm glad that my name is John Popasi. I'm gonna be your MC today for our forum A, track A. Please note that this session is 2 webinar concurrent sessions. คุณกฤษขึ้นหน้าที่เห็น2 session ได้ไหมคะ So we're gonna have track A and track B. So if you happen to be in track A incidentally and you would like to go for a track B, you feel free to leave this track and then use the URL for track B. But I would like to... Hello, anybody? Please turn off your microphone first. นะคะ Professor Chang and อาจารย์เกียรติค่ะรบกวนปิดไมโครโฟนนิดนึงนะคะค่ะขอบพระคุณค่ะ So I would like to inform you that if you leave this track and anyway then when you come back you might not be able to get into this session because the seat would maybe full or we cannot guarantee the seating available when you come back. So if that happens, if that is the case, then you will be redirected to our Facebook Live. Okay, all right, let's us look at the agenda for Forum A. We're gonna go from now, Forum A1. The topic will be on medical and health sciences. And let me introduce Forum A1 moderator, Dr. Prapat Wanitpongpan. Dr. Prapat Wanitpongpan is the Deputy Dean for Information Relations at the Faculty of Medicine, Siriraj Hospital. Dr. Prapat, will you please take the stage now?
Thank you, Dr. Jomkwan Ponpasi, for your kind introduction, and good afternoon, ladies and gentlemen, and welcome to AOWC-2020, which is an online conference focusing on COVID-19, the global new reality. And it is my great pleasure to be an MC for this session, and even more because we have 3 renowned speakers with us today. With their perspective, their idea, their experience, I believe this session will be beneficial to the audience. And allow me, without further ado, allow me to introduce all of the speakers briefly. The first speaker, he is an outstanding alumni of Faculty of Medicine, Siriraj Hospital, Mahidol University, with first-class honor and gold medal. He continued his education in the field of molecular biology and received PhD degree from University of Cambridge, United Kingdom. He also received postgraduate certificates in law and public administration from King Prachatipok Institute and in science, technology, and innovation policy from Harvard University. Currently, he is a Secretary General of National Research Council of Thailand, and also member and joint secretary of the National Council on Research and Innovation Policy chaired by the Prime Minister. He is Professor Siriraj Songsivilai. The second speaker is Professor Jang Wen-hong. He graduated from Shanghai Medical University and postdoc training from Beth Israel D. Kones Medical Center. His research work focuses on the pathogenesis, diagnosis, and treatment of viral hepatitis, tuberculosis, and other infectious diseases. He was a leader of the Shanghai Medical Treatment Expert Group in the fighting with COVID-19 pandemic in China. With his hard work, he became an online celebrity since then. Currently, he is the head of the Center of Infectious Disease, Huashan Hospital of Fudan University, and also a chair of Society of Infectious Diseases of China Medical Association in Shanghai. The last speaker is Professor Kiat Rak Rung Tham. He finished MD First Class Honor from Chiang Mai University and received a certificate of visiting fellow in HIV research at UCSF. He has dedicated his time working on allergy, HIV, and vaccine development, and his achievements have been recognized through several journal articles and national and international awards. He is now a professor of medicine at Chulalongkorn University, providing teaching and patient care at the King Chulalongkorn Memorial Hospital, Faculty of Medicine, Chulalongkorn University, and also a scientific chair of the Chula Vaccine Research Center. Ladies and gentlemen, please join me in welcome all the speakers. Thank you all the speakers for being here with us today, though we know that you've been very busy, your schedule have been very tight, so thank you very much for your contribution today. Let's start with the situation of COVID-19. It's been a few months that we have been fighting with this virus in Thailand. So firstly, I would like to ask Professor Sirirak to briefly summarize about the situation of COVID-19 in Thailand. I would like to help him share the screen.
Well, good afternoon, Dr. Papat and all the audience and the participants. Good afternoon from Thailand. I would like to begin by giving you a very fast tour on the situation of COVID-19 in Thailand so far. We have been in the about 3-4 months since the first case of COVID-19. Thailand is the first country outside China to have the case of COVID-19, and the first case in Thailand is from the overseas travelers coming into the countries in the second week of January. And since then, we have the quite a number of cases, but fortunately so far the situation in Thailand is well stabilized, and I want to walk you through some of the statistics and the figures we have. Can I have a next slide, please? This is the summary of the situation in Thailand, especially a focus from March. In the first 2 months in January and February, we have not so many cases, and the total number is was less than 100. But in the middle of March, the number of the cases increased, and our peak week is in the second half of March and through the first half of April. And after that time, the number of cases has been decreased. And as of today, in the past 2 weeks, most of the cases we have from the returning Thais from overseas, that all of them have been in the state quarantine. The domestic cases is less than in the single figures for the past 3 or 4 weeks, and most of the cases have been recovered, and we have very small numbers of active cases remaining in the hospitals, and the total number of deaths is remain at 57. So in that sense, the cases in Thailand is in somewhere the total number of cases remain at about 3,000. And so it looked like that the first peak of infection is behind us, and we are preparing for whatever the second or the third peaks of the spread. Have next slide, please. So the next 2 figures summarize the situation in Thailand. This figure is the country's map with the all of the provinces outlined from March 1st. As you can see that the number of cases remain small, and only active in the major port areas, Bangkok, and the areas that we receive overseas visitors And after middle of March, the COVID-19 spread very rapidly. And by the end of the month, almost all of the countries have seen the cases. Next, please. On April the 1st, the number of cases is about 1,500. And since then, it remained stable. And by mid-April, the number of new cases decreased. And in the next 4 weeks, most of the patients have recovered. And in the last figure, it is a few days ago, most of the countries has been cleared of the new infections. Yes, please. And this is the overall plot map since the first 100 cases. And the in the past 6 weeks, the Thai graph remained almost very flat. So we have about 4 weeks of peak infections from mid-March until mid-April, and after that the situation has been stabilized. Next, please. And this summarizes the classification of the cases by risk factors. So this is some of the information that I would like to share with you is that about 40% of the cases in Thailand have been traced to be in close contact with the other confirmed cases. The infection in the healthcare workers are still small, and the other area is the people with identified risk. And in the last 4 to 6 weeks, we have most of the cases are more or less imported from the arrangements of the Thai peoples returning from overseas, or from all of that has been put into the state quarantine. Next, please. The last 2 slides, what we have learned from these lessons, and this summarize the measures that the governments and the academic communities has response to the virus. First is on the public health measures. Thailand have a strong public health infrastructure that I would mention later on the disease surveillance. In a few days after the first report from China, we start our border check points at the airports and seaports and other areas. In that situation, we detect the first cases in the second week of January. And we also have a good system for the tracing of the high-risk contacts. And since mid-March, we have introduced the state quarantine systems, where all of the incomers have been put in the prearranged state quarantines for 14 days. And then after that, they have been tested before return to the communities, and the follow-up of the close contacts, the preparation of the resources and medical supplies, and the communication on the risk factors and the prevention. In the previous speakers in the previous sessions also mentioned about the use of the face masks and public health measures, and washing, and physical distancing. Regarding the face mask and the hand washing, more than 95% of the population at the peak of the outbreak wear face masks and also washing hands. On the crisis management, the government established the Center for the COVID-19 Situation Administration, CCSA, in the office of the cabinet to coordinate all of the administration regarding COVID-19 and the declaration of the COVID-19 as the communicable diseases, leading to the declaration of the emergency situations under the emergency decree. On the public health sessions, I think that we are doing well so far, as demonstrated by the relatively low number of cases and the low number of mortality. But we also, like other countries, are suffering from the societal and the financial effects regarding to this outbreak, and there are a number of measures that the government introduced, but these measures perhaps still not be adequate. Next, please. So this is my last slide. What we have learned regarding this situation so far, I think that we have coordinated crisis management system by the CCSA, which proved to be efficient in the public health and the medical science in controlling the outbreak. And one of the reasons for that is the infrastructure that Thailand has, especially on the area-based public health infrastructure. The troops, the ground people who work in the field of more than 100 healthcare workers who are 1 million healthcare workers who are working in the provinces and the sub-provinces area. The third point is that, as demonstrated by the CCSA, most of the decisions making process are based on information. The Thai public is now perhaps used to see the graphs and the demonstrations of the effects and anything like that. And the governments actually use those informations in the decision making process. And the fourth point is the public cooperation. And the last point is the collective learning and participations. And I should mention that is the adjustments of the policy and the measures, especially the coordination among the government sectors, academic sectors, and the public sectors. And that's the situation in Thailand so far. Thank you.
Thank you very much, Sirirak, and that was a sum up of the situation in Thailand during the last few months. So it seems that we can handle the situation quite well, like in China, where the first country that the outbreak occurred, and it it's apparently that China can control the disease quite effectively. So I would like to ask Professor Zhang two questions. The first one is, what is the biggest lesson that you have learned, and what is the key success factor that China has been utilizing in controlling the virus? Professor Zhang, would you please share with us?
Yes, and today I'm very glad to see that the Thailand actually have good results for the disease control, just like many other Eastern Asian countries. And I think it's the Thailand is almost the best one country in the Eastern Asian that controls the disease. And I saw the wave decrease very sharply. If I have some experience about how to control the disease in Shanghai, I think it's just like all the imported cases from China, the epicenter in China, Wuhan, And we know that we actually have several hundred cases imported from the Wuhan, the epicenter from China. And actually we have taken some similar control strategy like what the Thailand have done. According to my experience in China, actually we just do the diagnosis as possible as we can at this very early stage. According to my memory, that our first case in our city from Wuhan, the center, actually I think just like the cities from some other cities, other from Wuhan, actually we take the similar strategy. We do the diagnosis for every suspected cases as possible as we can. And meanwhile, I think another experience that our CDC staff, we do the tracing job very well. I think we have traced every patient, close contact of the suspected cases. And then sometimes we use the big data analysis to find the close contacts by the mobile phone and do the tracing very well. And another experience for us that we provided enough hospitalizations for all the confirmed cases, and we provide the maximum hospitalizations for all patients we found. Actually, we avoid the family transmission because we do not accept the family quarantine. We think the transmission in the family is a major part of our cases, the next wave of our cases. Therefore, similarly, we control very well in the other cities, not just, so just like Shanghai, Beijing, and other than Wuhan. I think in my city, first wave, we just have 350 cases. So that Shanghai is a 30 million population big city. However, if we take the diagnosis, tracing, and the maximum hospitalizations in the very early stage, I think it's very important for us to control the disease. Today, actually, we just face the imported cases from other countries. We just mean the second wave in Shanghai. In some other cities, they just lock down from other countries. However, Shanghai, like that in some, like Guangzhou and some big city in China, we still open for other countries. So therefore, today we face another challenge, the imported cases. However, we just did what we have done in the first wave. Actually, today, I think we can control the disease like Thailand, what you have done. So in the future, today we try to go back to the new normal life. I think we should take the experience from our first stage to control disease in the future. Actually, we have a lot of confidence like that in your country and other Eastern Asian countries. Thank you. Yeah.
Thank you very much. That was very impressive. I would like to once again congratulate China for your successful achievement that you can control the disease for the phase 1. However, everyone expect that in the near future, we don't know exactly when the second wave or the third wave will come eventually. I would like to ask Professor Chang about your strategy that you prepare yourself to face with the phase 2 or phase 3. What do you plan to do to handle the phase 2 or phase 3 in China?
Okay. So according to our strategy in the second wave and the third wave in the future, actually in Shanghai, from our experience, I think the timely and extensive testing and through tracing of every patient, and sometimes, of course, we still maybe, if we can, we will do the quarantine not at home. However, if we were lots imported cases, I think we will take the home quarantine for the close contacts of the suspected population. I think such strategy is still very crucial in the prevention of the control of the COVID-19 in the second wave. the timely diagnosis protocol and a timely quarantine measure in Shanghai, I think it will be very effective to stop the circulation of the in the city. And today, actually, we set up a network of almost 400 fever clinics, and meanwhile, some other sentinel hospitals. Such hospitals were positioned to collect all samples from suspicious cases, meeting one epidemiology just like from some other countries with the outbreak, and if have one relevant clinical symptoms, actually such network, the clinic will take samples. All suspected patients met with the criterion could be tested freely and without charge, and were admitted to the hospital quarantine ward to receive further evaluation by the city staff. Once the city staff confirmed the case, actually the confirmed cases also will be sent to the designated hospital for further treatment. So in the future, according to my experience, we will do the extensive screening and close to have a big network to monitor the fever patients and quarantine all the close contacts of the suspect cases. It will be our strategy. Yeah.
Thank you so much. That was really interesting. The next question is my concern is about because of the COVID-19, many hospitals that change their system a lot, and the patient have to adjust themselves accordingly. Something has been abandoned and some new thing has been introduced. I would like to ask for an opinion from Professor Siriler. How do you think about the change in medical care in Thailand, or the picture? What picture of the medical care in the future in Thailand that you see? And also this question for Professor Chang as well. Professor Siriler first.
I think that based on the situation regarding the COVID-19, we have learned a lot on what can be done and what could do. Like in many other things, first that we know that the public health measures work, and if we can put all of the healthcare or the public health and the medical resources to tackle one very major issues, we can perhaps overcome that. I think that this is just only for the first wave of the COVID-19. So far, we have passed this first peak, and we think that we are also well prepared for the upcoming one. However, that things come with the cost. I mentioned the societal and the economic cost, and it may also come at the cost of diseases, and that may affect the medical care. For example, during this outbreak, a number of medical services for other areas has been postponed or something, and we have to change that system in order to cope with COVID-19. We have to delay a number of operations. We have to delay a number of treatments, and so far we don't know how that's going to affect. Another point on the good sides, I think that these incidents demonstrate that we can reduce the density of patients in the hospitals, and that come into effect by providing long distance medical care. There are over the weeks we learned that there are also many things that we can look after the patients by not actually physically see them as often as we want, and the result might not be much different, but still a long way to go and to see whether there would be any long-term effect on that system. Thank you.
Thank you very much. Professor Zhang, would you like to share your opinion about the changing of the medical system in China?
Is unmuted.
Excuse me, but I don't think I hear Dr. Chang.
Yeah, yes, can you hear me? Okay, I'm so sorry. Yes, so today I think it's very important to change our medical care system just around. I think is about if we can control the epidemic situation within the controllable range to avoid the overwhelming of medical system and the excessive mortality. Actually, I saw that mortality in China and also in Thailand almost very similar, other than Wuhan city. Just in Shanghai, our mortality in our patients just around 1%. I think very similar like that in Thailand. In the future, I think if we compare the system from East Asian with the European and the American countries, I found that the strategy it should be, I say we should notice that we need to prevent and control our the epidemics within the controllable range. That means in European countries, they will take the hammer and the dancing strategy. Just once there's an outbreak, such as they should take a very strict strategy to lock down the city. However, if the range is among the controllable range, they just will take the dancing stage. That means they will gradually into relaxed, so not so strict the measures in their cities. However, in China and also in other Eastern countries, our epidemic is not so high. I think one of the most outstanding performance, just like your countries and in my countries, I think we need to take the very timely and strong prevention and the control measures. So it's very important. Actually, I compared the capacity of the ICU beds in the hospital with the European and the American countries. I found the capacity in our countries is really not enough. If we face the epidemics like that in Wuhan and also in New York, I think it will be very great challenge for us. So in the future, I think it's very important for us to strengthen our system that we can find sporadic cases every day and control every sporadic cases is very timely is very, very important. In the future, I think we will strengthen our system for us to give the comprehensive detection and tracing system strong control of the imported cases. And so I think it's very important for us. So in future, in Shanghai, we will take more strict prevention and control strategy. Of course, we will expand our ICU beds to meet the risk of in the future. However, I think according to my experience in Shanghai, also in other Eastern Asian countries, the most important is very important for us to strengthen the system, just find the cases early and control the close contacts and give the enough beds for the confirmed cases and stop the disease in the very early stage. I think it is still very important. Yeah. Thank you.
Thank you very much for your sharing. That's quite interesting. Well, my next question, I would like to ask all the three speakers, because we all are moving towards the age society. We have a lot more and more elder people in our society. So do you have any recommendation for them, for this specific population, to keep them safe, to keep them stay healthy? Start with Professor Sirirak first, and then Professor Chang.
One of the lessons we learned from looking at the data from other countries is that in Thailand, and I think perhaps by the in other similar Asian societies, that the way that we look after our elders may be different from the Western world. The way that we have the care home or something like that, putting elderly in the in one place is a little bit different. So, for example, in Thailand, our elder family members normally stay within the enlarged family structure. So the way when we look at the data from Italy and from Europe to prepare how we look after our all family members, we have to redesign our systems. So the way, in one sense, it would be more difficult in our setting to separate or to protect all people from the infections if they are if there is a very large outbreak. And but we also don't know whether that the system that we have actually protect the all people from this virus. Thank you.
Thank you very much. Professor Chang, would you please share your idea about taking care of the aging people?
Yes, that's right. And I think in the future we will return to the new normal, and we of course we know that the mortality is really related with the aged people. So I think we should keep the two things in mind. The first, of course, I think we should take the continuing of social distances, especially for the young people, especially for the young people who will return to the job. We know that they need to return to job. However, I think the majority of them have already or will return to work and control the epidemics among youngest, because they are, of course, in the future, they are the key part of the disease in our further control and the prevention. But we should keep in mind that they should still have to keep the social distancing, because we know that they are related with close contacts with elderly people. So I think the second aim in our study is more important, that we have to pay main attention to protect the elderly and the patient under immunosuppression treatment, just like some people with underlying disease. So that means not only should be the elders pay more attention about social distancing and hand hygiene in their daily life. What's more important, I think, is youngest. I think it's very important for they to stay in continuing social distance. Will also help their family members, especially the aged people. So I think today the most important is still we have to teach the young people. Although you have a significantly lower mortality rate, if ever infected, it's still not only about the older people, but that each one of us is fighting for other members of the society. So in fact that, so today you can say that in the future, this is not a lonely fight, and each one of us, we should share the responsibility together to control the disease, to protect the elderly. So the whole society should have the consensus. Yeah. Thank you. Yeah.
Thank you very much. And I would like to move to Professor Kiet. As we are mentioning about the elder people, one key point factor is to protect them from many infectious diseases, and we can do that by immunization. So I would like to ask you to update about the vaccine against coronavirus and also the recommendation from you for the elder people regarding the immunization or vaccine for other disease. Professor Kiet, would you please?
Yeah. Professor Prabhat. Yeah. May I have a slide, please? Yeah, I think one of the I would focus initially about the role of our university and each university, if how we can contribute to fight against this pandemic. I think we have heard that a number of innovation in this pandemics have been achieved through a number of biotech company and also in terms of vaccine development. You may have learned that at least the whole the WHO recently, at least more than one in under development, and about 10 have been tested testing now in the clinics. At least 2 vaccines, one from China and one from the US, that entering a phase 2 clinical trial. Okay, so maybe I can move to the next. Yeah, please go ahead to the next slide, please. I think I can skip some of this slide. Yeah, next slide, please. Okay, next, please. Okay, yeah. No, just move back a bit. Go back a bit. I think another yeah, I think that I just had mentioned that a total of more than 120 vaccine candidates had been worldwide, mainly in China and in US and many other European countries and some in the Asian country. 10 entering a clinical trial. I think the challenge is that let's say by early of next year or mid of next year, either one of the candidate vaccine in China, in next slide please, or in the US, in the state, have shown effective in protection of the infection or may prevent the disease severity. I think the challenge will be to look at the whole world population is more than and the US is 330 million population. So the global supply initially within the country, I think will be a big challenge. Next slide, please. So the question is why we're waiting for we contribute. Next slide, please. I think before we are going to do any assessment whether we can contribute, I think it's very critical to look at the ecosystem of the Southeast Asian higher education meeting. So I think setting up or building up vaccine development is not by a single day. So it need to be, setting up for years prior to the crisis. So I think the commitment from the university research team, technology development, expertise development, and great team and great partner, I think is very, very critical. So next slide, please. And when we look at our So I highlight in the pink, and you can see that we do have a vaccine research center, had some technology center. We have small animal facility, and we have a national primate research center. So next slide, please. So at the vaccine research, involving at least 3 or 4 vaccine development. Initially on HIV, which is really tough. So we have quit that priority. So dengue vaccine, leptospirosis vaccine, and allergy vaccine. And when it comes to the pandemic, we gather together our team and focusing on COVID vaccine, COVID-19. The next slide, please. Next slide, please. So next slide, please. I jump. We are a small group, but go back one slide. And please go back one slide, please. One slide backward, please. Yeah, no, one slide backward. Backward. Yeah. One forward. One forward. Yeah, one forward. I'm sorry. One forward. One more. One more slide. Yeah. And so we have 4 technology in the platform anyway. And then I think more important thing that we have collaborators both within the country, the national from the U of Pennsylvania that allow us to get access to mRNA technology. And we have a primate research center. Next slide, please. Next slide, please. Next slide. Yeah, we have a clinical research center. Next slide, please. Yeah. So then we saw the data of please slow down a bit. Yeah. Could you go back a bit? Now the technology, mRNA and the protein subunit. You can the Chinese scientist has published the sequence of the COVID-19 virus. So we right away we can start select the sequence of the virus that we believe. So next slide, so we can speed up this time. So next slide, please. Next slide, please. Yeah, so we have tested that which part of the virus should be used, and we know that we use the full-length spike base, and which technology we should use. So we found a good immune response technology, but at the end we select mRNA because of we believe it's a newest technology and can be in a more low-cost platform. So next slide, please. And this is the data from small animal, from mice. This is the surrogate neutralizing testing. So we have seen that the whole spike protein it generates good.
Professor?
Can you go to next slide, please? Yeah. Could you go to next slide?
You have only 1 minute, please.
Stop, so you skip to the last slide. Yeah, please go on, I'm sorry.
This one?
The last slide, please. With the partnership, both between the country and between the international partnership, which allow us to have the whole plan. No, go back to the Anyhow, so I think. So we anticipate that we can entering the clinical trial, and the good news is that we also have a local vaccine manufacturer willing to take the tech transferring to make a last for Thailand and also for some Southeast Asian countries as well. But again, this is a long way to go. Thank you very much.
Thank you, Professor Kiat. And because we are running out of time, I have one last question to ask Professor Sirilerk and Professor Chang, and you have 1 minute for the answer. Because we expect more pandemic in the future, not this one, but in the future, there will be some more pandemic, either virus, either bacteria or something else. In the past, we have done something good, but we might not be very good at in some aspects. So Professor Sirilerk, what do you think that what should we be prepared? What should we improve so that we do not suffer the big consequences in the next pandemic? 1 minute, please, Professor Sirilerk.
I think that the lesson we have in this case is that we need to keep learning, keep looking, and one of the very good lessons learned from this incident is that the networking is very, very useful. The information sharing, and I think that this could be the positive side coming, and for preparing for the next one, we need more information sharing, more networking, and keep learning. Thank you.
Thank you so much. Professor Chang, would you like to share your idea about what
Yes.
should we do? What should we be prepared?
Yes, I think today we have all learned the lessons from this crisis of COVID-19. It is, and we also will know how to face the emerging infectious disease in our world. So I think today we are having a higher recognition for the medical and the science professionals and the innovation research, just like the vaccination and the clinical trial and in the progression. However, and we are now, I think, we're still not aware of the essential support of the citizens' need in this time of epidemic. In future, I think we need a combination of the case detection and the tracing network, make the network more strong. And further, I think we should improve the clinical treatment strategy and the scientific local prevention system. Of course, we have to enhance the research in the vaccination. So in this new normal state of our world in the future, my opinion is that we should all fight wisely and toughly and with solidarity. We should live in the new normal state before the vaccination launch. Yeah.
Okay, thank you very much. And because of the time constraint, I'm afraid that we don't have time for Q&A. I think that's the wrap up of this online conference in part of a new global reality in medicine and health science. I would like to thank you all the participants for your attention, and also thank you for your kind cooperation of the honorable speaker. Your knowledge, your perspective are really very valuable. And lastly, I would like to thank you for everyone for making this online session possible. And we expect to meet all the participants again in the next event. Until then, have a nice day and goodbye. Back to Dr. Jomkwan, please.
Well, thank you, Dr. Prapat, and the session forum A1 speakers, Professor Dr. Sirilerk Somsivilai, and Dr. Chang Wen-Hong from Shanghai, and Professor Kiat Rakrumtham. Thank you very much.
Thank you.
Now we're going to move on to
Thank you very much.
Thank you very
thank
much.
you very much.
Bye now.
Thank you. Okay, let us move on to forum A2. We're going to skip the session break because the timing is not that nice for us. So there's so many things for us to share today. And so let's move on to forum A2 now. Could you please share the screen about forum A2, please? The forum A2 is about economy, business, and services. And here we have Dr. Vikram Ahuja, our moderator for this forum. Dr. Vikram is the managing director from Edison Motors Company Limited. And please welcome Dr. Vikram. Dr. Vikram, are you here? Have we invited Dr. Vikram here in a room with us?
Can we take a break?
Probably 5 minutes, please. Maybe
Yeah,
5
sure.
minutes.ฮัลโหลค่ะ ใช่ค่ะ ยังไม่เห็นเลยค่ะ ท่านยังไม่เข้ามาเลยอ่ะหมอ สวัสดีค่ะคุณกลินท่านเข้ามาในห้องนี้แล้วใช่ไหมคะท่านได้ยินเสียงไหมคะทีมงานฝากเช็คนิดนึงค่ะ
ฮัลโหล
สวัสดีค่ะ
ผมลิงครับ สวัสดีครับ
สวัสดีค่ะคุณลิงค่ะ We're gonna start in a few minutes. We are looking to locate all the speakers.
Yes,
It should
just
take
now
a
we
few
were
minutes,
all in the
please.
room. Just
Yeah.
now we were all together.
I see. Alrighty.
I think
Dr.
Kun
Vikram,
Kalin.
are you here? Yeah, I can hear you well, Mr. Ling ka. And
Okay, so I on mute now. Okay.
okay.
Thank you.
Your video looks fine too. Thank you.
ได้ยินไหมครับ
ได้ยินค่ะท่านคะ
ได้ยินนะครับได้ยินครับผม
ได้ยินไหม
ได้ยินค่ะท่านคะ
ห้ามออกแล้วนะอยู่นี้นะเมื่อกี้บอกให้ออกไป
ค่ะขอบพระคุณค่ะดร.วิกรมพร้อมไหมคะ Okay, so let us move on to introduce Forum A2. The Forum A2 will focus on economy, business, and services. And here we have Dr. Vikram Ahuja, our moderator for this forum. Dr. Vikram is the managing director from Edison Motors Company Limited. And please welcome Dr. Vikram. And I will ask Dr. Vikram to please introduce our speaker, please. Thank you.
Hello, everyone. Good afternoon, ladies and gentlemen. Welcome to the Forum A2, the World Congress on the COVID-19 and the Global New Reality. My name is Vikram Ahuja, and I will be moderating this forum. Our issue today is economy, business, and services, which is a really key topic right now as many countries are starting to recover from the pandemic. Before they realize that the longer and tougher journey is the economic and financial recovery. In this forum, we will elaborate on several key points on this front. First of all, let me introduce all of you to our panelists today. Well, as a moderator, I couldn't have dreamt of a better panelist. Our first panelist is Mr. Kalin Sarasin. He is the chairman of the Thai Chamber of Commerce, a board of trade of Thailand, and the chairman of the Tourism Authority of Thailand.
สวัสดีครับ
Mr. HigherLearning, who is the chairman, CEO, and the owner of the Big Green Public Company Limited. His company focuses on a variety of fields in development, financing, construction, operations of greenfield power plants, to name just a few. Our third panelist on your screen is Assistant Professor and Dr. Thanawat Phonvichai, who is on the board of Singh Estate Public Company Limited, the Thailand Government Lottery Office, and the Rubber Authority of Thailand. He has just been appointed as the president of the University of Thai Chamber of Commerce in January 2020. Here is how I'm going to conduct this session. So I'm going to ask a series of questions to our panelists, one question per panelist, and each panelist will have around 10 to 12 minutes to answer. The audience can also participate by sending your questions or comments through the Q&A feature of the Zoom. So I can ask our panelists for you. So let's begin with one question to Mr. Kalin Sarasin. Well, So according to your role and responsibilities you have in your many positions and appointments, I believe you have been working as kind of a collaborator between the business sector and the government sector for many, many years. And this collaboration has become much more important than ever during this pandemic time in terms of maintaining the sustainability of the economy. So would you mind sharing with us all the collaboration between business and government, what has been done and what you think should be done to help each other improve and strengthen our economy? The stage is yours.
Thank you very much. So good afternoon, everyone. So today we'd like to share about the business sector and also government sector, how we cooperate together during this period, COVID-19 period. So I'd like to move to the next page, please. This has been going on for a while. So as a business sector, I represent many organizations. For example, we have a joint stand committees on commerce, industry, and banking. We have have meeting with many CEO of large company in Thailand. We have provincial chamber of commerce, the foreign chamber of commerce, trade associations, University Thai Chamber of Commerce, and also many academics people join with us. And we focusing for Thai Chamber of Commerce, we focusing into 3 fields in value chain. The first one, the trade and investment. The second one, agriculture and food. The third one is tourism and services. These 3 value chain consist about 70% of the Thailand GDP. So once it's happened, the government wants to close things down, many things. So we try to voice out to the government what should we do and what we are concerned. So you can see on down there. So we try to sourcing the face mask, we keep distance and many things, medical equipment, all these. So then after that, for a couple of weeks, and then government set up the new team to approach this issue together. So next page, please. Okay, so I divide into 3 phases. The first period is about closing down the period. So start out from the metropolitan, Bangkok metropolitan governor. They closed down the Bangkok. So at that time we said, oh, it's so urgent. You haven't told any of us at all for business people. But as a business sector, so we grouped together and voiced out to the government, saying that the essential business should be open and should remain open. For example, the import business, export businesses, the value chain of food, the value chain of pharmaceuticals, the factory, should be still open. Logistics should be still remain open. And also essential activities for daily life should be still remain open. For example, for the food, supermarket, restaurant should be take home. For drugstore, convenience store should remain open. And also we always out to the government saying that if you're closing down, but business should act as usual, as much as possible. It's very important because if you close down everything and business close down, also the economy will be so bad. So the government really listened to us and then come out with the emergency raw decree on electronic media conference. For example, you can have board meeting, you can have shareholder meetings online. This is what we encounter. Next, please. So during the COVID period, so we, as a business sector, we group together many CEOs and get together, and then we discuss together what shall we do, what can we help the government, So the first thing he said, okay, how about we ask the doctor first, what can we help, what can we do, what can we help, and then after that the doctor, majority of doctors said they need the swapping testing room. So I'll show you later on what's look like. So we come up with an invention. How can we do the swapping room, you know, from handmade or from knockdown, something like that. And then afterward, we said, okay, and what else you want to need? And doctor said, how can we do the speed up for COVID-19 testing? Can you buy some equipment for that? So okay, I'll show you later on what we do it. And then after that, we help the government to do the medical equipment for throughout Thailand. We asked the health ministry to see what do you have and how many medical equipment, the essential one, and then where it is and how many of them can workable. Some of them need to be fixed. So we get a group of people together and then fix the respirator. Okay, next page, please. Next page. Okay, this is a group of the people that have meeting together. Next page. Okay, this is we came out with 4 types of the modular screening units. The left one is a big unit. The second one is a negative pressure for isolation room. This put in the ICU. So this is already being used right now. And the third one is also a small chamber for testing, scrubbing, and also the fourth one also same thing. So we come out with this, and then after that we raise fund, and then we distribute throughout Thailand. So right now we distribute more than, I say, 40 to 50 provinces already. So it has been helpful. Next, please. So this is we give up, for example, the scrubbing room on the right side. On the right side, see that the doctor doing. You can wear a jacket and ties, and then you do scrub it without have to wear the PVC PE clothes. So that's saving a lot of clothes. And you can see that we also on the right, bottom right, that's Kun Sarawut Yuvitiya. He gave the machine, I think about maybe 15 million baht machine. That's for testing, quick testing, about 1,400 units per day. That will be move very fast. And then that you can see Coca-Cola there. That we give the machine and also the swapping room to the south and handling by logistic by Coca-Cola. Next page. This is cooperation for ventilators repair center. This is joint venture between SCG, Toyota, and also Kubota. We fixed the respirator about maybe almost 160, 170 units, and then sent back to the hospitals. Next, please. And then afterward, the government asked us to be an advisory board on the COVID situation administrations. So I'm on the part of second row. So that and be resuming business. So the government asked us to help for after closing for a while. How can we open the resume business together? Next page. Okay. So this is the procedure that we have meeting together and how we do it. The first one, we set up the committee to work together, consists of many parties involved with the doctors and also with the NGO, with many people involved with that. And then after that, we design process how to open up the business. And then after that, we have 4 stages of activities from low risk, medium risk, moderate risk, and also high risk. And then after that, we have proposed to have a basic requirement to open, and then they have manual for each activities to open. And then we also have a track and trace system with the digital technology to help tracing in each individual and also at each activities have been open. Next page. So then after that, the Prime Minister asked us to come to present. and they can see the doctor, I mean the prime minister, sit at the head of the table, which is a key person in the government, ask us to come to present our systems. You can see that our working team involving the health department, the doctor, the expert, and also NGO, academic side, and also private sector. So our group consists of maybe 15 or 20 people. We have a meeting quite often for that. Next page. So this is the principle. The first one, we prepare for the risk for the business sector and also the provincial sector for the risk. The second one is basic requirement for all business. And then after that, we have manual for each sector. But before the manual, we asked the trade association who are expert in each field, come have a talk with the doctor and discuss together and how can we make a manual as a safety to open. Next page. Okay, this is the criteria for a business sector. You can see that on the right side, you said, okay, level of risk, low risk, medium risk, and high risk. And the risk factor for the first one, the density of people. If you have activities that less than 1 meter, that means high risk. But if you more than 1 meter, it's low risk. The time duration, if you spend more than 1 hour in this activity room or something like that, you have more high risk. You spend less than 30 minutes, is low risk. And also activities. If activity you need to talk, to shout, that means high risk. If you come into this area and then no talk, it's mean low risk. And then after the airflow and ventilation of the room, if you have ventilations, good ventilation, it means low risk. But if low ventilations in closed door, like that, so it's high risk. Next page. So this is we come out with this table. The vertical one, you can see that I have in provinces low risk, medium risk, and high risk. I presented the Prime Minister, and he said he considered in Thailand everywhere it's the same. You don't have to divide into low risk, medium risk, and high risk because very difficult to manage if you divide like that. But on the right side for business, he said he agreed with us to have low risk business, low risk for the small size, low risk, medium size, and also medium risk and also high risk. Something like this, he agreed with us on this proposal. Next. Okay, this is basic requirement. So at least the density should be 1 meter or 2 meters apart, spending 1 hour, no noise, and also ventilation. And also the basic, maybe some places you have to wear a mask during activities, and also you have to measure the temperature of the body temperature, and also maybe you have some alcohol to sanitize your hand. Next page. Okay, and also we should have the track and trace application we call Moshana. So a group of people come out and write this application. So this Moshana is for tracing for people. In the morning, you're just tracing if you have a fever, not fever, something like that. So this is Thai people right now. We are loading Moshana now. And also down there is called Thai Shana. Shana is mean winning. Thai Shana performing for the scanning. When you go to the department store, restaurants, or everywhere, you have to scan. Once you scan, you say, okay, you check in, okay? And when you finish your activity, you have to check out. This means that you know which period where you locate yourself. So sometimes in the future, when they said, okay, this person had COVID disease at that period, he went to somewhere. So you can send SMS to you and you can check yourself with the doctor that you caught disease or not. So this is how we design this QR code scanning. Next page. So this is a manual for each activities and in detail. For example, the first one, you go to the market. The second one, you go to the restaurants. The third one, you go to a department store, something like this. We have all these manual for each activities, and then this is on web online. You can load it for free. Next. So next activities, what we plan to do next is in the future will be a lot of people lost their job. So right now we're launching job matching platform next week. But right now we're testing this platform with Accenture, the American company, to do this. And the second one, we're launching Thailand. We call Amazing Thailand Safety and Health Administration. We launched a standard of safety health check for each location for the tourist spot. And the third one, right now, we are working to open up the domestic tourism. So we like to boost local economies. The fourth one, we talk about what's the new normal in the futures. For us, we talk about the tourism, agriculture and food, also trade and investment later on. And also right now we have some pending issues. When the pandemic comes, this is very urgent and important, but the government forget it. So right now we are pressing the government to work on this part. For example, the multilateral negotiation. For example, CPTPP, FTA with EU, and also right now the government have to ban the 2 toxic farming chemicals used in agriculture, but it's no way out for the farmers. So right now, something like this, we have working closely with the government during COVID periods. Okay, next. So far, this is my I like to close with my comments right now. Thank you very much. Thank you, Kap.
Okay. Okay, so thank you very much, Mr. Kalin. So it's good to hear that we have so many plans and procedures of the private sector and the public sector working together. As we all may have noticed, during this pandemic time, the government makes so many significant interventions and also the help in response to the outbreak of the virus. And as a result, the businesses need to rapidly adjust to the changing policies, changing needs, not only the needs of the government, but also the needs of the people and their customers, their suppliers and everything, right? And most importantly, while at the same time, they have to navigate the financial and the challenges in their operations as well. So this scenario is so intimidating, but it's obviously unavoidable, right? So which led me to the next question on business transformation. Mr. Link, since you were involved in so many areas in business, in many industries as well, would you mind sharing with us what are the key business transformations that you think Thai business should follow to keep up and also maintain its competitive advantage in this crazy time?
Thank you very much. Well, I think in Thailand, we have been through very many crisis periods. And so I think the Thai business people, they are very good at adapting. And you have heard just now the chairman of our Thai Chamber of Commerce and Board of Trade, where we have 140,000 members. And you can see that the chamber is really excellent in making sure with the government that the economy could go on and continue. I think what we all know now is where the COVID came from. And the interesting thing is that this is the first time that the whole world since 1918 was so strongly affected. And it all came from wildlife trade. So like HIV, like SARS, like Ebola, it all came from wildlife trade. But this time, not only a few countries were affected, by the whole world. So I think from the business side, of course, we all have to try to learn how to deal with that. But on the other hand, I really hope that the whole world will understand that wildlife trade is really behind many of these great diseases, and we should try to avoid wildlife trade and everybody work together not to have wildlife trade, for only the wild animals where they are. Could you maybe show some of the slides? Thank you. So next one, please. So you can see the baby there with a mask. And so we all concentrate on trying to do something good for the affected people. Like, of course, our company also did a lot, even buying insurances for health workers and buying lots of equipment and face masks and so. But if we stop it at the source, then I think the world will be a much better place for the wildlife and for human beings. So next one, please. So I said already that we have passed many crises in Thailand over the last so many decades. And this crisis again, it lets us see how resilient and prepared we are and how good our organizations are in bad times. So we overcame the Asian financial crisis. So you can see that our banking sector is quite strong. We overcame the 2008 hamburger crisis quite well. So actually most of the businesses are very resilient. And then the government came in, they're just passing big bills to support businesses and to support people who lost their jobs. And the Thai Chamber of Commerce also is going all out to have reskilling projects going on. I think this crisis also shows us what type of leader we want and what we don't want. So I work very closely with Kun Kalin in the chamber and also in the Thai Red Cross. And I think these are the types of leaders we want. And you can see that our healthcare system also had good leadership, and our government showed good leadership and good cooperation with the private sector. Another thing that we need to understand really well, how to deal with people's fear. So this is the first time that everybody in the company was so much affected and they were afraid. So we have to talk to everybody and and try to understand whether they're fearful or not. What has been really important that we look at people's individual health, help them to have strong body resistance and overcome fears and work together in a way from home or at the company in a positive spirit so that we overcome the crisis. And I think Thailand has shown that we have a very good healthcare system and the government work well together with the private sector. Next slide, please. So one question was, what will never be the same again? I think Thailand is very much a Buddhist country, but of course we also have Christianity and Islam. And this opportunity to be more at home or to deal with such a crisis, I think it gives a better opportunity for people to go inside themselves, to spend time with their family, to look after their own health and other people's health, and find out who we really want to be and try to go more deeply inside ourselves and open way for spirituality and see how can we have peace inside when outside is in turmoil. And I think in Thailand is quite open to spirituality. Like in our company, we start every meeting with 5 minutes of mindfulness, and we promulgate to do business with compassion so that everybody has a good attitude towards each other, wants to really help society. And I think this has helped us a lot also during this crisis. Next one, please. So of course, everybody wants to know what will never be the same again. And clearly there is now a much bigger focus on healthcare, on your own, their own immunity strength, and on the healthcare system in the country. What I'm very happy to say is that we have donated hundreds of thousands of face masks and over 10,000 insurances and so on to the healthcare system. But when we wanted to donate to one of our university hospitals a respirator, which was difficult to get, that hospital said, oh, please give it to our sister hospital because we don't have so many cases anymore. So, and then we had somebody in the company who was in the hospital. He was not really that sick, but they wouldn't want to let him go home. And my conclusion, even though he was negative, my conclusion was that they didn't have so many patients, so they wanted to make money from him, which otherwise, if they had so many critically sick people there, they would have sent him home a long time. So I think work from home, home delivery works in Thailand excellently well. And of course, the internet usage has gone up a lot. What will be interesting to see is how much more manufacturing will happen close to home, especially in the healthcare sector, both in Asia and in Europe, and the way we look at globalization. Of course, with nationalism having become stronger in the past, there was already a move away from globalization, but now one sees, I think, the interruption of the transportation and maybe close down in other countries. So for maybe a number of essential products, governments will look more at doing that at home. Next one, please. But one thing I think we should also remember that people always do the same thing, but over time do it differently. So we all sleep, eat, socialize with friends, do sports and so forth. And changes are slow. When I went to a PhD course in the year 2000, my professor, one of my professors at that time, he said, we don't need offices anymore. We can work from home. And it needed COVID to show the world that actually many people could work and many times from home. So that's 20 years later. And I think once the crisis is over, there will be a balance between working from home and working in offices. Next one, please. So you had also asked who are the pandemic winners. You can see that people who adapt fast, organizations that adapt fast, they get through crisis well. So the future has always belonged to the innovators, and I think this pandemic shows it even more. And of course, a strong winner is communication technology, and also, of course, communication content. Education, reskilling, upskilling, changing, becoming more savvy with information technology, very strong at as our Chamber of Commerce has a university, it's called the University of Thai Chamber of Commerce. It's the only one in the world belonging to a Chamber of Commerce. And we just introduced a new part of the university, is called Harbor Space at UTCC, that educates willing entrepreneurs, young people, also older ones, how to understand internet communication technology, how to understand entrepreneurship, and and then they are taught only by people in the business in small modules, and they have to come with a project. So when they come out, they are already professionals. And so also in the vocational system, we try to use that system more and get professors more involved in dealing with business. And then, of course, the whole health sector will change. We'll also probably go away from big hospitals for parts and more clinics, more telemedicine, and greater cooperation among hospitals all over the world and, of course, all over the country. And we also find, of course, that staples will always be in demand, and they did very well. So whoever's, I think, in the staples business is fine. Next one, please. And I think some other winners on the pandemic will be human relationships, spirituality, and maybe moving away from bigger cities, being more away from from infectious areas. So rediscover family and friend relationships. The other thing that will happen, of course, with all this money being printed all over the world, there will be a further increase in prices for long-lasting assets, which we already have seen since 2008. And what the government, I think, has to do is we have to have more social housing, because housing in cities becomes less and less affordable. We have more and more poor people who we have to educate that they have better jobs, that they become professionals, because there will be more and more automation. And we have to create social housing or housing at affordable prices, so that the lower income groups and also the middle classes, they can really afford a proper place to be, so that we have stability in our society. I think that was it. So this is my part to this subject. Thank you very much.
Thank you, Mr. Link. I love your slides on the pandemic winners, because in every crisis there always lies some opportunities, right? And what is better than us be able to pick the brain of one of the most successful businessmen in Thailand. So thanks a lot for your insights. Now let's expand to the broader picture here, the economy. So many world economists say that this crisis is even worse than the World War, which is kind of huge. As an expert economist, may I ask Dr. Thanawat for your analysis on the domestic and global economy? What are your thoughts on the 2020 economy and the economy in the near future? And what are the implications that would mean for the normal people like ourselves in terms of the quality of life? The stage is yours.
Thank you, Dr. Vikram, and good evening, everybody. I have about 20 slides, and I try to speak each slide briefly. And could you please open the slide for me, please, Dr. Vikram? At first, I'd like to tell you about the economic outlook during this time. The University of Thai Chamber of Commerce, as we call UTCC, is the university that owned by Thai Chamber of Commerce. That's why we work closely with business sector. We have an economic forecasting center, and we do a lot of survey, ask people, ask consumer, ask businessmen, and we develop consumer confidence index for 20 years. And we just developed TCC member sentiment index. That means a business sentiment index for 3 years. And we collect all information about the impact of COVID and what they think about the situation in the future and reason. And I'd like to discuss about 3 topics. Next, please. The first one is the current situation. The next one is the outlook this year and next year, and the government role to stimulate economic performance. Next, please. At first, I'd like to tell you about the story about the economic outlook. It's hard to predict or to forecast because we never learned about the situation like this before in our lifetime. I think during 100 years, we just learned about economic crisis from financial crisis. We never have a pandemic crisis before, so it's hard to predict. And recently, we have a few information about actual data or actual impact, economic impact from COVID-19. We learned that COVID-19 is found last year and it spread out globally in March this year. And at this moment, we have around 5.6 million cases throughout the world and the big number of dead people. And it's make many countries go into economic contraction in the first quarter of this year. And this year, it will push the world go to the economic recession. It's not depression for me. Depression is the negative growth of GDP that we will have a negative growth for 2 or 3 years and big number of unemployment. But I think the negative growth of GDP should be at this year or maybe next year. If we can recover quite soon, maybe only this year. I'd like to speak on next page, please. I'd like to show you about the country that have a big number of GDP in terms of GDP. About 10 countries in the world that you see on the chart is account for 67% of GDP, of global GDP. And you've seen that, and you learned that. All of them have a lot of huge number of COVID infected cases. And number 11 is last year, they have a lot of number of infected cases as well. So this means a big 3 number of infected cases right now is United States, Brazil, and Russia. Still have a problem about control COVID-19. And most of them, I think they try to solve the problem. And right now, I think we learn and experience the flatten the curve of infected case. And many countries are relaxing the lockdown. I'd like to show you the next page, please. And I think COVID-19 halt business and economic and social activity throughout the world because of government lockdown. This means all activity in economic, business, and social is halt. Domestic private consumption and investment are declined, and in international trade and tourism subdue. And we survey a lot of survey about consumer confidence index and business sentiment index in Thailand. It's become worse, and we have the lowest level of consumer confidence index for 22 years. This means Thai people don't want to consume. I think it's the same thing around the world. People discouraged to consume. They worry about the employment situation in the future, and they think they can earn less money, less income, and business sector as well. When you reopen or restart the business operation, you have to control many things. You have to keep social distancing, and you have to control, or you have a limitation of the number of your clients. This means you can earn less amount of money. So we try to think, and we try to collect the data when the normal situation will come. And I'd like to show you the next page. That's the problem throughout the world. Because of COVID-19, we have a decline in demand for all commodities or all products and services. The price going down. Still at the low level. When the energy price going down, the agricultural product price become worse. This means farmer or poor people throughout the world gets less money. That's why they don't want to spend, and they have a problem if they have money less and they worry about their future situation, about their employment, their salary. Maybe it's become worse, and we don't know when consumer confidence index and business sentiment index will recover. We have to check, and we have to continue watching what's going to happen. Next, please. At the first quarter of this year, many countries began to face economic slowdown. As you see on the chart, many countries such as Eurozone, China, Japan, UK, Hong Kong, Singapore, Philippines, and Thailand experienced the negative GDP growth. And it's the lowest growth in 40 to 100 month or quarter. So this means it's hit hard. The COVID-19 hit hard to the global economy. Next, please. The answer that the world needs to hear is when COVID-19 vaccine discovered, if we cover COVID-19 vaccine, this means this pandemic will be stopped forever and everything gonna be better. The second question is, will we experience second wave or third wave of COVID-19? That's why many people, many government worry about that. So this means we still control many business operations because we like to control the number of people get into the shopping center or something. So this means the vaccine, if we found as soon as possible, it will be better, or it will be the best for the world economic recovery. And what's the bottom of this economic recession? And how long of economic recession? It's gonna be V-shape, U-shape, W-shape, or L-shape? And next year, how about the GDP, global GDP growth? Is high or low growth level? This is the question that everybody like to hear. I'll just show you the experience. As I mentioned to you at first, it's hard to predict because many things is uncertain. We still have unclear picture about COVID pandemic, and we still wait the vaccine. If we have the vaccine, everything gonna be clear. This means COVID-19 problem will be stopped soon, as soon as vaccine is found. The global economic outlook is hard to predict, as I just mentioned to you, and many countries still have the problem about control the situation and boost up economic activity and business activity in their countries. Next page, please. According to IMF data, they predict that this year global GDP should grow -3% because of COVID, and I think it's a lot of risks ahead. Next, please. This is the data of the IMF. You can see that for this year, 2020, the world GDP should grow about -3%, and as one economy grow -6.1%, and emerging market and developing economies grow about -1%. And next year, they think every government throughout the world try to inject the money and use huge stimulus package to boost up economic activity. And if think next year it should be V-shaped, that means next year global GDP should grow around 6%. Both advanced economy and developing economy will face the bigger number, the big positive GDP growth. How about the country in Asia? You can see that we face negative growth on the right side. We face negative growth in ASEAN. And next year, ASEAN will recover and get the big number of growth. Next page, you can see that this year, many Asian countries experience negative growth because of the shutdown of tourism activity. We have no idea yet when we totally relaxing lockdown. We don't know. We allow tourism, or we allow tourism industry or tourists travel abroad when we have no idea yet. And we just think many people try to open up the tourism sector. We just hope that this fourth quarter, everything gonna be a little bit better. People can travel to each other and tourism sector will be recovered in the fourth quarter. And if the government inject the money by using stimulus package, huge number of stimulus package, the global economy will be better than this year. So next year, ASEAN, every country in ASEAN will grow at a higher level. Next page, please. I need to show you something about the economic stimulus package around the world. Next page, please. Many people think about how big of economic damage this time. Many people estimate that it's around 10% of GDP. It's about $8 trillion. And they think this time is the government spending time to stimulate the economy because consumer and business sector still worry about the future. If the government inject the money first and move economy recover, and then consumer confidence and business sentiment will become better, and everything gonna move to the better side. Next page, please. In COVID-19 situation, I think it's hurt every economy. And the average size of economic stimulus package is roughly about 10% that I just mentioned to you. Next page, please. Because of the damage is about $8 trillion, about 9 to 10% of GDP, of the world GDP. Many countries, many governments try to inject the money as few as possible. For example, USA used about $2.2 trillion for the skill package to boost up the economy. And Japan used about 20% of GDP package. South Korea is used about $70 billion for economic stimulus package. And for Singapore, they use about 20% of GDP. And the next page, Thailand also the same track. Thailand use about 12% of GDP. We use 1.9 trillion baht or $60 billion for stimulate the economic recovery. So this is on my presentation. We have no idea yet that where is the bottom of global economic recession. We just hope that the bottom is around the third quarter, and we will start recover in the fourth quarter. It depends on economic lockdown internationally. If tourism activities can operate normally, tourists start visit to each other, to another country, I think that should be better for the world economy. And next year, if the government inject the money, huge number of money, and their stimulus package is efficient enough, the world will be better in the next year. We can learn the growth of GDP, global GDP next year is around 5 to 6%. I think this is all information that I'd like to present to you this time. Thank you.
Can you turn the mic on?
Thanks a lot, Dr. Thanawat. Okay, so it's so obvious when the virus arrives, then the next thing we worry about is the healthcare. Once the healthcare is fixed, then we have to worry about the economy. So there are so much details, so much more discussions that we're gonna hopefully be able to do. There are so many areas in the economy as well that we need to talk about. So, but unfortunately, we ran out of time. So I hope that that our discussion in this session proved valuable to you, to the audience. And if you don't mind, please give a virtual round of applause to our panelists today. And thank you so much. And I hope we see each other again sometime. Thank you.
Thank you. Thank you.
Thank you.
Thanks to the moderator and the other panelists.
Thank you very much. Thank you.
Thank you.
Thank you very much.
Thank you. Bye.
Thank you very much, Dr. Vikram, and the speakers of the HU, Mr. Kalin Sarasin, Mr. HigherLearning, and Assistant Professor Dr. Thanawat Paul-Pichai from UTCC. Now we're going to move on to Forum A3. The topic of A3 is City, Living, and Tourism. And do we have some time for a little break, or should we go ahead? Dr. Antika is the moderator of A3. Dr. Antika, are you here? Dr. Antika, can you hear me, please?
Yes, please give us a sec.
Okay, so maybe like a few minutes break for Dr. Antika to get ready and all set up. And Forum A3 will be about city living and tourism, and we are so grateful to have Dr. Antika Sawatsi. She's going to be our moderator for Forum A3 today. Dr. Antika is actually the Dean of Faculty of Architecture and Chairperson of the Council of Deans of Architecture Schools of Thailand. Really right on spot for the city and living design, especially for architectural aspects. Okay, if you're ready, I can just give the stage to you, Dr. Antika, please. Are you ready?
Thank you very much.
All right, thank you very much.
Okay, thank you so much, Dr. Jongkwan. Good morning, good afternoon, and good evening, everyone, anywhere in the world, and welcome to the Parallel Forum A3. This session will focus on what are the next reality in the city, living, and tourism. I am Assistant Professor Dr. Antika Sawatsi. I'm the chairperson of the Council of Dean for Architecture School of Thailand and the Dean of Faculty of Architecture at the KMITL. I am the moderator for this session. This session, we have honorable three speakers, consist of Associate Professor Dr. Chachat Sittipan, the former Minister of Transport of Thailand, and will follow by Associate Professor Dr. Prapatpong Upala, the Director of the Smart City Innovative Research Academy, or SAIRA, at KMITL, and Dr. Yuttasak Supasorn, the Governor of Tourism Authority of Thailand. This session, we will have each speaker about 10, more or less 10 minutes, and followed by Q&A. Though the COVID-19 pandemic is far from over, countries around the world are beginning to consider step by step to ease their lockdown restriction. With a return to some form of normality in sight, now may be the best time to foresight and look forward. What may come after this crisis? How the city, daily life in urban area and tourism industry will be transformed after this. Gentle people, I would like to start with Dr. Chachat, who can help us to anticipate how we can cope with the economic downturn after we traded off with the triumph in saving life of thousands. Let me introduce Associate Professor Dr. Chachat Sittipan, the former Minister of Transport of Thailand. Previously, he held the position of the President, CEO, and Executive Director of Quality House Public Company Limited, and the structural engineering in the most leading engineering firm in the world, SOM, or Skidmore and Owning and Muriel Limited Liability Partnership, and a course director in the Faculty of Engineering at Chulalongkorn University. He received a bachelor degree and MBA from Chulalongkorn University. He got master degree from the Massachusetts Institute of Technology, or MIT, and a doctorate from University of Illinois. Dr. Chachat, please, the time is yours. Okay. Hello, Dr. Chachat. I think he is here in the waiting list. Maybe his name, the Better Bangkok. Better Bangkok. Okay, so Yeah, it's quite exciting because we are now at the time of dinner, and it's a good timing for Dr. Chacha to share with us.
Okay, sorry,
When you're ready.
sorry, Ajan
Okay.
Neil.
Okay. When you're ready,
Sorry.
please.
Okay, so I need to share my screen. Could you take off the screening first? Because I think someone is sharing the screen.
Yeah, we'll ask the
Okay.
host to share.
Okay.
Thank you.
Okay, all right. Okay, thank you, Dean Antika. Okay, all right. Sorry for the problem. Okay, here we go. Hello everyone. Governor Yuthassak, Dr. Prapath-Pong, I will share my observation during the COVID experience that I have in Bangkok. All right, not academic work, but more on the idea and observation. The topic would be the trust economy. So during the last 2 months, I have been on the ground visiting the communities affected by the coronavirus, and many families suffer a lot from the economic disruption. So I have been thinking, what would be the guideline of the theme that we can use for the recovering after the COVID-19? And then I come up with the term trust economy, which is not a new idea. I think it's maybe an old idea, right? Because trust has been the core of the economy for hundreds, if not thousands of years, has been tested, reinforced. And then I think now it's even more important than ever. I think trust has been the core of the economy activity, from barter trade, from coin, from fiat money, electronic money, cryptocurrency. So when you look at blockchain or Bitcoin, we call it a trust protocol. So during the last decade, I think we have lots of activity in digital economy. And the problem is that we cannot see, it's invisible for the buyer, sellers, or even the products. So they need to create some trust system in order to we enable us to do the economic transaction. We have the rating system, feedback, know your customer. So when you cannot see, you need trust to have the activity. So I think it's similar to the coronavirus that we have at the moment. Because it's an invisible enemy, we cannot see the coronavirus. So we have to halt all the economic activities because we don't have trust in one another. So we need trust in providing goods and service. So look at Thailand. Thailand, I think from the disease itself, we don't have that much effect because we have low number of cases and deaths. I think we have a good healthcare system, but the problem from the economic is big, huge. I think there are 3 factors: tourism. Governor Yuthassak maybe can elaborate more, but it accounts for 12 to 20% of GDP, and we expect the number of tourists decrease 67% this year. Export usually account for nearly 70% of GDP, and due to supply chain disruption, it may shrink 7%. The local consumption account for nearly 50% of GDP, and we expect the social distancing cause us unemployment, nearly 7 million employees. Overall, we have the GDP contract maybe 5.3, or some even say 6 to 7% this year. So all these factors, I think, mainly it caused by the absence of trust from the coronavirus. So I think in order to bring back the economic activity, we need to create trust in the post-COVID era. So where does trust come from? I think there are the tripod of trust that we need to establish. You need to have a shared values, you need to have a character and a competency. So these 3 can create trust in the society. In the character, you need integrity and good intent. You don't do it for yourself, but for the public good. Transparency, no corruption. Share values. The leader need to have some similar values among population, and the leader have to walk the talk. You need to be competent to gain trust, good capabilities, and good track record. So they are the key tripod that we have to focus in the post-COVID world. And the trust has to be done in all levels, from the macro level, in the nation, city, business, activity, sport, concert, community, or even in the smallest level, it's a personal level. So I will share my idea on 3 levels, how we can create trust among the nation, business, and person. To be a trusted nation, I think you have to start with healthcare for sure, because the crisis started with the virus. So it had to end with the containing of the virus. So the country must isolate, test, treat, and trace. So to create trust after COVID, you need to improve or perfect your healthcare system. And I think the tracing would be the key thing that many countries use. In Germany, they propose the immunity passport for people. They have the tracking device for Israel, or even in Singapore, they have application called Trace Together to show the risk of each person. In Thailand, we have application called Moshana or Winning Doctor. The Moshana use technology of GPS and Bluetooth to show your risk of being in close proximity with a person who get the virus, the COVID-19. And they will rank you in 4 colors: low risk, medium risk, high risk, and extremely high risk. Maybe the app is not perfect yet, but I think it's the one device that we can use to create trust among the population. For the country, you need good strategic planning. In the second factor, I think a lot of government will have a big stimulus package, use a lot of money, quantitative easing to try to stimulate the economy after the COVID. In Thailand, we have 1.9 trillion baht economic stimulus package, about 60 billion US dollars, divided into 3 packages. 1 trillion dollar divided into 2 parts, 600 billion baht for health-related and financial aid to affected people, 400 billion baht for several projects after COVID. The second degree, 500 billion baht for loan to SME, and 400 billion baht for corporate bond liquidity stabilization fund. So these 2 packages clearly create trust in the financial sector. So we need trust that people still confident in the financial institution. For the 400 billion baht, I think the question would be how can we spend it efficiently? So you need some guideline, some beacon that will be the ruler for checking your use of the money. So I think trust may be one of the indicator that you can use to judge the project. So how to do it? Maybe you start with a competent trust team. You need a good team to create trust, and then you might have trust communication, trust healthcare, trust infrastructure, or trust advocate. Healthcare, you can have a staff. You need to improve staff, facilities, and system. In the infrastructure, you need transportation, public space, public utilities. Trust advocate, you need standard for each activity. You need to audit, to check your procedure. You need trust training for people, for staff. Trust communication important because you need trusted information. You need trusted channel of communication and trusted feedback to evaluate your trust creating process. So this is some idea of how you can spend the package by using trust as a theme of implementing the project. You have to assist the community. It's a map of Bangkok, and it shows you the communities, the fragile community that got affected by the coronavirus. We have about 1,500 with 1.2 million people in this community. So you have to building trust from the bottom up, helping them improve the quality of life, create trust in the smallest element of the community. And then you have to communicating trust to the world. I think I propose the idea of Trust Thailand, creating, we are doing well in the healthcare. We have limited number of cases, a low number of deaths. We can use this as a leverage to promote Trust Thailand. And I think other countries start doing that. When you look at South Korea, Facebook of the South Korea Embassy in Thailand, they have promoted trust for nearly 2 months already. They have campaign trust, which is transparency, responsibility, united action, signed together in solidarity. So I think you will see many countries will start promoting and building trust to gain confidence and bring investors, travelers, and economic activities back to in the post-COVID era. For business, you need to do standards, improve the standard in your procedure. You can see convenience store in Bangkok, 7-Eleven, they never stopped during the pandemic. They open, but they adjust their standards. So we have to help mom and pop stores down the road to improve their standard. You see adjustment. There's a market in Myanmar. From indoor, they move outdoor, creating social distancing, create trust among buyers and sellers. Even in the food store by the street, they have screen, create trust for the customers. In Amsterdam, they use a greenhouse for each table in the riverside restaurant, even in the for the crew member in airline. So you have to adjust standard for creating trust among customer and the staff. Technology important to create trust, I think. I went to
for 2 minutes, sorry.
Okay,
2 minutes.
I went to this restaurant when they opened, and then there's no menu in the restaurant. You just use your smartphone to scan the QR code, and the menu appear on your phone. So you have to touch menu and risk of contaminating or get the disease through the menu. You see many innovation. You will see stabilized chamber, automatic cleaning for rail in escalator, cleaning of the food before you enter Paragon shopping center. I just found it today. So there are many technology that can create, improve trust among people. Use rapid test for passenger plane. And you need to take care of your stakeholders during the crisis. Take care of your customer, your staff, your suppliers, even the community, to show and to gain trust that you are reliable during the crisis. For the people, trusted people start with health and your routine. Don't create risk. Don't be a risk for your community or your family or your workplace. You have to be competent. I think in the post-COVID world, the business will be tough and very competitive. So they will be lean and need productivity. So as a member of the business, you have to be competent and you have to have a broad and deep knowledge. And last but not least, for person, I think the unselfishness would be the key thing too. We will not trust the selfish company. We won't trust the selfish person. So I think sharing, compassion would be the key thing of create trust. I think in Thailand, in Bangkok, and in Thailand, you see the cupboard of sharing. I think many of us see it. People who have more put foods and other things for the people in need to take it. So this kind of sharing and show unselfishness, we create trust among us in the community. So I think trust is a key thing. Without trust, we have no future, and then we have to start designing and managing trust in the post-COVID world. Okay, that's it. Thank you for your kind attention.
Thank you so much. That's Dr. Chacha Sittipan. It is just right to the point. And maybe I like to sum up what many things, just the highlight, maybe not only for the question, from your proposal to the public to apply the trust model to revitalize the economic after the COVID-19, of course, which was developed in elsewhere like a South Korea context. To what extent it can be applied to the context of Thailand that has a relatively high socio-economic inequality. Some of the vulnerable group, for example, who have not yet accessible to basic necessity, they may not have any opportunity to choose based on trust, but by their affordable price. Can you explain a little bit further for the use of trusted Thailand to lead the economic development after this crisis? And of course, my question is, who will be the middleman that can make people trust? Because even though in the normal situation, the trust among the city people, for example, is already a challenge. But what happened after this crisis? How can we make trust to, mobilize our economic to run?
Okay, thank you, Tika. Thank you for your question. I think you made a good point that in Thailand, I think the problem of inequality is very important. So the degree of trust creating may be different among group of people. So,
I'm sorry for interrupt, Dr. Chachat. Your voice is just a little bit lower down. Can you? Yes, please. Thank you.
Okay. I think you make an important point because inequality is a key problem in Thailand. So I think creating trust might be unequal among people. The big company might have a capability to create trust, and I show you in the slides. In the convenience store, we can so many chains, they can create procedure standard very effectively. But for mom and pop stores down the road, maybe more difficult. So I think you need some assistance from the government. And maybe, as I said, trust is more like a objective or the beacon that lead your projects, And in details, every level has to start cooperating on that. And for the one who doesn't have resources, I think maybe the government or the public should be helping them, providing standards, providing training. So it's a key element in the trust ecosystem. So I think we have to maybe reduce the inequality in trust creating too. Yeah.
Thank you so much. Very clear cut, but it is just the appetizer for about the trust economy. For anyone who interested, that you can search more or find any other channel. Thank you so much, Dr. Chachat.
You're welcome.
Okay, thank you. Now, let me move to another honorable speaker. Very interesting as well, because in the theme of city living, of course, we have to looking on what will be the next reality in the city living, particular in the urban realm. Now, let me introduce our next speaker, Associate Professor Dr. Papathong Upala. He is the founder and director of Smart City Innovative Research Academy, or SAIRA, at the King Mongkut Institute of Technology, Lat Krabang, or KMITL. He graduated in Bachelor of Engineering and Master of Urban and Environmental Planning from KMITL, and research staff at Institute for Transport Study, University of Leeds. And 1 year later, he obtained his PhD in Civil Engineering, Transportation and Traffic Engineering from Chulalongkorn University. After 10 years work, Dr. Papathong Upala is an associate professor at the Department of Architecture and Planning, Faculty of Architecture, KMITL. He specialized in smart city, especially transportation planning, urban development, and infrastructure and facility services, and big data and analytics. His interests also cover land use and transportation research, bike and walk research, and multidisciplinary design research. Dr. Papathong, please share your perspective on how the urban planning and life in the public place will be like in the next reality. The time is yours.
Okay, you can hear me, right? Okay, so, yes. Okay. Thank you very much, Dr. Antika, and I am pleased and thank you for the president, the committee, and the organizer for this forum for me to share my idea and my information. And today we have to talking about the city, the living, and tourism. So just a little bit, we talking about the new normal. So I have to show some picture of the conventional function. This is Bangkok. They have a lot of traffic jam and the floodings. Yes, we have the 24-hour and funny city, right? And we have a little bit more the diversity of the people to join together in the road. And we have to walk in the city and go to shopping. And we have, for humans, we have the sports center or something like that. We have to watch and see the entertainment or something like that. And we just it's the crowd of people to join together for runnings, for marathon. This is the competition of the human. So, and we have the congratulations, but we have to learning in the conventional. This is KMITL, right? But we talking about the seminar or conference like this. But today is the change. It's the new of my life. It's the new of maybe it's the new of things. The new normal. It's the new normal for we talking, we seminar online for the sitting. So I have to show some the information for a new normal for the city and living in our country, right? For the first slide, we have to, what is the city? Why the city is the center? I think for the city is an economic system, social system, political system, and technological system. And that's why some people, they have to go together and accumulation together because they're more productive. And some people, they go to join together, they have a lot of wisdom, they have to challenge and smart. But we have the challenge of the city, we have the problem of information issue, we have the socio-economic issue, technological issue, transportation issue, and well-being issue, and political issue. But now, for the living, we have, for the conventional, we have more needs about education, food safety, clothing, recreation, healthcare, accommodation, transport, entertainment, politics, and equity. That has a lot of needs of our human. So maybe just the academic feelings and concept viewpoint. So just we talking first about the type of tourism. For the conventional, they have a lot of tourism. They have the main point of cultural tourism, yes, and wellness tourism, sport tourism, eco and sustained tourism, or culinary tourism. But for last 4 months, we are changing. The system is changing. They have a COVID-19 pandemic of our city. So everything has changing. I think everything is changing. We will go to the new normal. We have to go to the new normal. But I just a little bit summary of the city before the COVID-19. Maybe we stay in residential areas about 20% and workplace 50%, maybe for 8 hours or 9 hours, and we have to commercials for shopping about 10%, and recreation area for the parking, entertainment about 10%. But new normal, it's just changing. We have the workplace only 20%, and we stay at home and work at home about 60%. Commercial is reducing about 10%, but I think for recreation area and entertainment maybe 10%, just the academic point. So for living before COVID, I think they have a lot of things of we need politics, we need education, we need safety, we need equity, we need the fashion. But for the new normal, just back up. Go back to the new basic needs. We need only food, healthcare, academic, accommodations, and clothing. That's why this is summary of our change of the city living and tourism. I think for the city, they have just for the first conventional, they have the physical infrastructure, but we moved to the COVID-19. We have think more about digital infrastructure and platform. We have to invest some digital platform. But for living, I think maybe we have focused on the main point and necessary of our lives. And tourism, I think in the future, we have to focus maybe for the new alternative of tourism, something like natural activity, virtual reality, digital museum. They have maybe it's a new one of the digital museum and low density tourism. For the new normal of city and living, I think maybe it's relationships between the mindset and behavior. It depends on our mindset and behavior. If we have the mindset is come from the work experience, the culture, the education, the belief, the emotion and motivation. This is sent to the perceptions and sent to the our behavior is go out, right? So if we have to change mindset, we have the concern or awareness is COVID-19, yes. The behavior is changed. We have the self-protection, they have the shopping, they have the traveler, they have the food, they have the party. They just only necessary behavior and protections and avoidance the crowd area. Just this is change of mindset. Just show some example of the mindset. If we're concerned about the COVID-19, we have the wear the mask and we have the habits, and maybe the result is the coronavirus case is reduced, the death is reduced, yes, and the recovery maybe is increasing. This is, we can apply for these concepts about physical distance. If we put the mindset, we have the information, we give some information for the people in the city. The behavior is changed, we have the habit is changed. So when we're talking about the urban planning and city design standard, maybe change for the capacity, right? For FAR, BCR or something like that. Or maybe tourism management will change. It depends on your behavior. So we just, for the example of the design of a new normal of city and live and lifestyle and living in KMTL, we have the smart physical distance with AI. We have to check, we have to CCTV, and we have to software to analyze and alarm in some place, something like if we have smart physical distance with AI in the library for some student. When we open education, open the new term, we have to apply this in lecture room. Maybe it's good. And we can apply in the math sciences, right? And for running tech in KMTL or something like that. And if we have in Thailand, they have a lot of street foods, so we have to decide for physical distance with AI or something like that, or canteen for the safety. But I think some people is concerned and awareness of healthy already. So we have to sharing room, right? And waiting area for use public transport. We can apply of this for design. And for the public transport with physical distance, maybe I think now we have to design already and implement already in the minibus or bus or conventional bus or airport, airplane already. So this is self-protections. It's a new normal of our life. We have a lot of, this is the real world. I have stuff of my life. We have the item of my life is the real world. We have a lot of face masks or something like that, and alcohol gel. So this is social distance. This is implement already. I think there has a lot of in Bangkok. They have a lot of things already.
It's another 2 minutes. Sorry.
Okay, thank you. In summary, I think the crisis before COVID, we have PM 2.5, the crisis of environments. Maybe I think Corona is the crisis, but sometimes it's the opportunity, right? The opportunity for the lockdown from the COVID-19. We have the cleaner air quality. Yes, a lot of China, yeah, a lot of Bangkok, there is the good new one. I think when we're talking about ourselves or human, we can rock down, we can upskill and reskill, we can cook. We don't know, we cook before. We can dancing, we can drawing, we can photograph, we learn to plants and garden, we have time to software, to learning, to graphic fashion, language, shopping online, card game or something like that. But when we talking about the COVID, we have less something less, such as connection is less, travel is less, party is less, cash is less, company is less, fashion is less, and work hard is less, spending is less, economy is less, living with friends is less. But in the opposite side is the more. We have the digital platform more, the big data analytics more. We have more online education, we have online shopping, we have more work from home, we have more the food delivery company, we have the healthy and fitness and space and clean and time and skill. We have living with family and smart work and eat, but we have eat more and fast in the end. So I think this is less is more is the conclusion of this. So we have to balancing with concern and awareness with the healthcare, economics, and society and politics. Maybe it's balancing just now. COVID has changed our life, our human for the new normal. So we have to balancing everything. I think maybe we have to move this way. This is sufficient economic philosophy of King Ramanai. Yes, he talking about the middle way, the moderation, reasonable self-immunity with knowledge and moral condition. Maybe less is more is the middle way. I think the conclusion of this, maybe we have the crisis and opportunity. We have to balancing of everything together. So I think everything can be in by our thinking and our behavior. Thank you very much.
Very sharp. Thank you so much, Dr. Praphatpong. It says, but sometimes we heard several 10 years ago, but less is more still, vivid in the daytime and nowadays, right? I have just a quick question because you mentioned a lot about the urban life, the city planning discipline, right? If the city planning and the public transport, either in the public space, have been designed in order to enable the city people to live life together, meet as much as possible, gain the base quality of time, quality of life after, life after what happened, life after the COVID crisis. The city people receive new information amongst almost every day. If you heard from the news in many kind of media that personal safety come with the social distancing, physical distancing. So some very urge and encourage you stay at home, work from home, for example. Dr. Praphatpong, because you are in the education and academic, and I wonder, can you explain more or anticipate the key things that we need to change, maybe in the planning education, planning teaching and learning from now on? Many things has changed already. So what kind of thing that we need to change in the education as well?
So I think for the education, for the urban planning or city planning, I think maybe we teach some students about the long term and short term. COVID just like the short term, something like emotion. For the long term, for me, is like the function. Something right when we build some home, some housing, emotion like interior design, like you, right? And decorations, we concerned about mood and tone, but we can adaptive anything. But for the architect or structure engineering is a function. We have the strong structure and steel and concrete and area. These are functions. So for we design and teachings and implement urban planning, we have to devise for the long term. The long term, we just to follow functions. They need to build, they need to design, they need to invest some methods, the mega project or something like that. But we have the short term, something right. If we have the new one of virus, not only for corona, but we have to change. But a little bit change is a short term. We have just only improve or adaptive, but we have to follow the functions. We have to invest some functions of our life. I think the urban planning may be to separate and teach, and maybe for virus, corona, I think not only for the new normal, just a little bit, just the short term. The short term of the short term for our reskill or less. I think I hope that.
I can catch many keywords. It's quite rethink about in the education and learning process, either emphasize on more on function for long term. That's very important keyword. Thank you so much, Dr. Praphatpong.
Thank you.
And the last but not least, very honorable speaker, we have Dr. Yuttasak Suphasorn, the Governor of Tourism Authority of Thailand, or TAT. Dr. Yuttasak received a bachelor degree from the School of Economics, Chulalongkorn University. He got master and doctoral degree from Graduate School of Economics at Keio University from Japan. He held many important positions at national level, such as the former senior executive vice president at the big media company in Thailand, MCOT Public Company Limited. Also, he was the leading position in the Ministry of Industry as a former director of the Office of SMA Promotion and as the former director of Food Institute. Today, we are honored to have Dr. Yuttasak with us. He is the one who has been tackling with the most challenge in pandemic crisis, when the coronavirus frees the tourism industry. As we have known, it is the core economic income of the country. What will happen after this? What are the next realities when our tourism industry is recovered? Dr. Yuttasak, please share your thought with us. Thank you.
Thank you very much, Dr. Attika. Thank you for your kind introduction. Hello, everyone. Sawadee krap. Dr. Chatchat and Dr. Praphatpong. It's my honor, pleasure to be here with all of you to share my view on the Thai tourism under the new normal or the new reality after the COVID-19 crisis. The coronavirus disease 2019, now we know that the COVID-19 outbreak situation has made tourism activity halt, not only in Thailand, but all around the world. For Thailand to restart, the tourism industry must be under disease control measure until a vaccine has been developed to prevent this disease. This has affected a change in the behavior and the pattern of travel and tourism. Firstly, I think nothing will be the same. The Thai tourism industry had encountered countless negative experiences, but this time is the worst. Everything must change to survive, and it needs an increase in the capability for long-term competition, because tourism must be under the disease control measures. Tourists will be held so they can protect themselves and help prevent the spread of the virus to other people. Only the strong travel, it means that tourists will focus more on their health and safety. The data on the cleanliness and basic health will play an important role in their decision-making to travel. There will be data sharing for the sake of the public in travel and tourism to reduce the risk from the pandemic. Everything under control. Tourism products and services can be offered under the limit of the disease control measure, especially ones that concern travel, people movement, and the mass gathering. Rise of the individual. We expect that Gen Y to be the first group who will come back in the recovery period. Therefore, service must be adjusted to serve the behavior of this group. They are self-confident, self-assured, think outside the box, have high standards, like new innovation, and smoothly care for family and friends. In addition, the situation may affect tourists to change their behavior to be isolated and focus more on their survival and safety without care for others. The digital future is now. Modern digital technology that reduce touching but support social distancing and encourage activity that are under the limit of travel, people's movement, and mass gathering has been applied to the business and the marketing operation. Next slide, please. There is not only a change in behavior of tourists, but also a change in pattern of travel and tourism before and after COVID-19 crisis. Before the COVID-19 crisis, we see a lot of tourists travel in a large group. But after the COVID-19 crisis, they become more FIT or free and independent traveler or traveling in a smaller group. Before the COVID-19 crisis, travel to long-haul destination or international is so common. But because of COVID-19, travel to short-haul destination or domestically is preferred in order to reduce the risk. There will be shifted from conventional tourism or emphasis in activity that are involved in entertainment or physical relaxation to healthy tourism. Tourists will focus on healthcare and let tourism will be a part of having good health and happiness. Before COVID-19, people enjoy traveling to meet other people and make new friends, especially with the local, or we call contact my holiday makers. But after COVID-19, there will be more traditionalists who enjoy traveling that is safe and without risk. And there will be change from moderate travelers who prefer traveling that take time to budget traveler who seek for leisure and tourism at a low cost that is partly caused by current economic situation. The change that require less traveling, catering, crowdness, and touching due to the COVID-19 outbreak has caused pattern of new lifestyle behavior we call new reality or the new normal that has brought about changes in the Thai tourism industry. What is the new normal in both demand side and supply side that need to be adjusted after the COVID-19 crisis? We have to accept that tourism is being driven under the supervision of public health. For demand side, there are some elements needed when tourists want to travel again. Advanced booking will be required in all kinds of services. Everything go booking. Travel plan will become a necessity, including a number of people, date, time, and expenses, which will need to be calculated beforehand under the restriction of numbers and social distancing conditions. The enthusiasm and desire of tourists and tourism-related parties to participate in promoting responsible tourism for society and environment help manage the quality of the environment and solve problems caused by tourists, such as waste, pollution. Tourists will pay more attention to safety to protect themselves and prevent the spread of the virus to others. Information about the cleanliness and hygiene will play a significant role in tourist decision-making to travel. Information will be shared for common benefit in travel. Digital technology will help reinforce valuable experiences for tourists. It will also help promote impressive tourism experiences and create confidence among tourists by giving them convenient, safety, and accurate information while traveling, which will influence the decision of tourists to revisit. The technology will include mobile tag and trace, a tracking system which verify and track each individual and all devices in real time, with recognition a technology which will recognize face and eyes to help screen the number of tourists entering places. Augmented reality, or AR, and virtual reality, VR, a presentation of augmented and virtual data will be integrated with the world of reality to help customer make a decision over their traveling choices. And smart travel assistant, a smart virtual travel assistant, which is trained to assist or give travel experiences. For the supply side, it is believed that Thailand tourism industry after COVID-19 will not be the same, just come back stronger than before through the adjusted operation under the new normal. The problematic point will be resolved. A sustainable basis will be established for survival. In addition, the capacity to compete in the long term will be increased. The readiness of the supply side is considered one of the factors affecting the speedy recovery of the tourism sector. How about the adjustment of the supply side? The operators may have to remodel their business, and the economy of scale might not work if there is still a limit to the number of service users. The operators must focus more on doing a short-haul marketing or domestic marketing while quickly applying digital technology to a business operation. Giving priority to the employee skill and development, the reskill or upskill to maintain the service quality and the competitive advantage over the others, as people are the heart of the service business. They need to be developed to meet the increasing customer demand, especially in safety and hygiene. Adjust to a new business balance as the competitive landscape has changed. The market growth has declined due to the decreasing number of tourists. The original target group might decrease since there might be a risk group and still do not dare to travel. Therefore, a concrete way to handle with the excessive resort allocation must be set under the new normal. That is, the Thai tourism should be under the new normal. Thank you very much, Dr. Atika.
Just right, the perfect time. Thank you so much, Dr. Yuttasak. Okay, so you emphasize a lot about the new, let's say, the new reality and the next step of the tourism revitalization. As a tourist, and also the tourism industry is one of the main source of income of Thailand. And this industry has been hit the most during the crisis from the current epidemic. Focusing on tourism recovering plan, you mentioned elsewhere and here a lot about emphasize on safety and health. And this cover many kind of sectors. This seems too much depend on visitors and foreigners from outside of Thailand. While some media, just for example, in the Lonely Planet, they anticipate that international air travel may not return to normal until 2023. Or some say that this might be the end of globalization, for example. Will it be a chicken and egg solution? I don't know. If each country has confidence building plan to, for example, you have the road to SHR, for example, how can we make the traveler or investor in the tourism industry that has more courageous to make a decision? Can you highlight more? What kind of factors that make investor that want to invest in the tourism industry in Thailand?
Well, I think that for the new normal, the tourists will focus more on the health and safety. The data on the cleanliness and basic health will play, as I said, an important role for the people to come. And why? What make them confident to move again, to travel again, is the key. So that's why Tourism Authority of Thailand introduced what we call Safety and Health Administration that to make people, international and Thai tourists, obtain a good experience and very confident in safety and health from tourist product. You said that what is the element that bring the people come to Thai again? I think that there are many things that I would like to highlight. First of all, I think that the safety. Thanks to the system of the public health in Thailand, the good management, that it's very efficiency. And I think that we recognize, you can see the number of casualty is very small and less than we expected from the beginning. So we can use it. For instance, for the medical tourism, and they're very confident in the system. I think that they will come. And there are two more things that keep people come to Thailand. The second one is about the familiarization. People love Thai food. People love Thai culture. That's something that they used to be, get used to. So we're thinking of Thailand, they're thinking of the food, and they want to come back after lockdown exists. And the last thing is about the beauty of the nature. You can see after two months of the lockdown, and the nature flourished. You can see a lot of things that never happened before. Very beautiful in it. And the most important thing that will keep people come to Thailand, I think that is Thai people. You can see the Thai hospitality. You can see Thai people doing during the crisis time. Can I use Dr. Chachat about unselfishness? It's really beautiful. That I think that no one like Thai people. This is the elements that the key driver that bring people to other people come to Thailand. Dr. Atika.
Thank you so much. Just right back to the point. So the key important asset that we have, one is natural, and the key important thing is the human resources. Thank you so much, Dr. Yuttasak. Okay, let me ask to the team, do we have some few minutes for our three speakers can wrap up something very brief? Dr. Chachat, would you like to have something like 30 seconds close?
Okay, thank you, Antika. Yeah, I think thank you for all the.
A little bit the
okay.
voice, yes, please.
Okay, thank you, Antika. I think thank you for all the panelists that give insightful information. I think life goes on. The new normal might not be that much different. So I think we have to live by weeks and see what is coming. I think we have to bond together. As Governor Yuttasak said, I think Thai people is resilient, and we have a good character of unselfishness. So that's a key thing. During the time that I doing the groundwork, visiting the communities, I see the strength in Thai people. I mean the sharing, the unselfishness, so the compassion. So that's the key thing that impressed me, and I think we can survive this crisis together, and we will become better and stronger after COVID-19. I guarantee. Thank you, Krab.
Thank you. Dr. Prapatpong, you have half a minute.
Okay. Today, I think, unfortunately, for the connection between people, social community has blocked or locked down from the COVID-19 pandemic. But I think the most important thing is that we are awareness of ourselves, our family, and our community is the best way, and we have to strong together. I think we have a hero together, especially in Thailand and in Bangkok. The number of the death is 0. I think we have a hero together, not only for medical staff, but every people. We can stay at home. We have physical distance or anything. We have to believe. We have to control. We have to learning, and we have to share something together. I think Thailand is really lovely. Thank you.
Thank you so much. And Dr. Yuttasak, you have some very brief and short summary?
Yeah, I think the Thai tourism industry is so resilient. We have encountered countless negative experiences, but we come back every time stronger. This time is also, I believe that, but we have to do something that different. The problematic point will be addressed and resolved. The sustainable basis will be established, and don't give up. We come back stronger, I believe.
Thank you so much. And I really enjoy, and the keyword today is the resilience. And I think you heard this word elsewhere as well, that we can absorb what happened and can we fail and then recover very fast and come back and life go on. Thank you so much. And again, Dr. Chachat, Dr. Prapathpong, Dr. Yuttasak, I'm looking forward for your participation in the next world reality. Thank you. Bye-bye.
Sawasdee krap.